Good afternoon. No falling asleep just because I'm the last one. So I'm excited to be here, and I feel like I've been drinking from a fire hose, which you probably do too, and now I feel like I'm going to spew from a fire hose because I have a lot to tell you in 15 minutes before she shows me my sign back there that my time is up. So I want to start just a little bit because I want to touch on some things that people always ask about. So if I can at least leave you with that, I think that you'll find our program, Tandem 365, very intriguing, and ask yourself some questions. How in the world did it ever come together? I think the important thing for you to know is that we are not a part of a health system, and we're not a part of an ACO. We're very much independent and came together as independent providers. If I can figure out which one? Oh, there you go, the big green button. So basically, Tandem was established in 2013, and that simply just means we came together as 5 providers. And I didn't list the partners' names here. They're all from West Michigan. You can see them on our website. But the important thing to know about those 5 providers is 4 of them are from continuing care retirement communities and 1 ambulance service. That's the 5 people who make up Tandem 365. And the exciting part of that is that those 4 retirement community partners who are much bigger than just independent living and assisted living. They also have nursing home facilities, skilled nursing rehab facilities, certified home health, private duty. They serve thousands of patients every day, and they're competitors, or were competitors before all of this happened. Very much not wanting to share in the market space, certainly competing against each other and all of their own entities and all their own business lines until the day that the hospital started having to deal with readmission rates. And that's when we were all pulled in together to talk about, okay, who cares how many referrals we give you every day? How many of you are getting our business? We want to know what you can do for us. And that was a whole different conversation because we knew it was happening. Everyone was talking about it, but we didn't know how it was going to impact all of us either. So that's when we all came together, a lot of people around a table to talk about what can we do for the hospital. And their question was, how can we stop this back and forth between your rehab units and the hospital setting? That was really just like the grassroots of the conversation where Tandem is today. But it was a good conversation because we are in all those settings and we do have patients, right, that we're sharing back and forth. And we had really poor communication streams, fax machines, as someone mentioned today, pages and pages of information that you would get, where somewhere on page 96 someone mentioned that hospice had been talked about. But we didn't know that because we never made it to that page before someone in our skilled nursing facility was deteriorating and we sent them right back in. Those were all the problems that we were dealing with at that time. And then the partners came together, and there was a lot about that. I could go on a whole day about that. But basically, we're together today. We've served over 700 since 2014. And I want to share a little bit about what's important, and that's the participant's story. So when I look at our programs like ours, we tend to sometimes focus just on the medical about what we do, because we have a lot of resources in our program that do a lot of medical care. And of course it matters, because every referral that we get is a high complex medical need person. That's how we get them. That's the only reason we get them. We want us to save them money, so how do we do that? But the stories that I want to share today with you are mostly about those social determinants that sometimes get overlooked. I mean, you can't see them on a claim, right? And the insurance companies, the only way they have a clue is if they're telephonically managing them and they hear it and they guess that something might be happening that needs to be dealt with. So today I want to talk a little bit about Larry. He's a 79-year-old male. And it's kind of a sad story because he's developmentally delayed. So he lived with his mother most of his life. And then she passed away. But he was independent enough to live alone in the same house that he was raised in, which, by the way, had a lot of problems. And he was aging, and he had a lot of medical complexities. He fell a lot. He was in the ER a lot. And, you know, we really didn't even know where to start with him. The really sad part was that his mother had appointed a trustee on his behalf when she passed away. And the problem was the trustee did not have Larry as their best interest. It was a man who lived in the same trailer park near them, so that she picked him. And so his needs were not being met, to say the least. So it was a journey to try to figure out what to do for Larry. And once we could uncover this trustee issue, we did get a pro bono attorney to work with us. Our social work department is fantastically involved in the community and know which resources to go to. We had a pro bono attorney who did get him a different trustee. And right now, those trustees are very involved in his life, in and out of his home all the time, making sure he has food, making sure that his home is in good repair, needed a ramp, making sure that they're visible, so he's falling a lot less and never goes to the ER anymore. So the great part about Larry, where we can celebrate his medical needs are being met, he also can live in his same home with the support that he needed. Which all those things, when we created Tandem, were never going to be on a fee schedule. Every single thing that we could think of someone needed was not on a fee schedule. It didn't have a billing code, and that was the problem. But when we created Tandem, we took Harry, which was an invisible person, kind of like a poster child, and we said, let's just put Harry through every single thing that could happen in his life today. Lives alone, no social supports, never picks up his medications, always in the donut hole, can't drive, doesn't go to the physician, whatever you could list them, right? 30 things. And the thing about Henry is that he needed something, and everything that he needed is not what his insurance would cover. So when Tandem came together, we said, you know what? It was almost a room this size. We had all kinds of people in the room, and let's just map out every single thing that could happen to Henry in his life, and let's figure out a solution. And let's not think about whether it fits on a bill or an invoice or a code. Let's just create it, and then let's put it to life. And that's what we did. And so my second story is about Lori, and Lori is 60, so she's relatively young. Trust me, she's young. So she also had a ton of problems, mental health issues, that made her unable to manage her complexities. And she hoarded, so she had tons of things that no one needs, right? But she couldn't get rid of anything. She had a recliner that was her favorite recliner that, by the way, sometimes she didn't even get up to go to the bathroom. She just sat right there and went to the bathroom. So all these complex medical issues that she had were compounded by all this other stuff that unless you have a focus on the social determinants, you can't help that person. They don't care if they have an advanced care plan. They don't care if they have a DNR. All they want to be able to do is to manage their bills. And you know what? When Tandem came in with their social worker, they helped her to get her bills in order and to manage her payments and realized that she was living in a place she couldn't even afford. It took us a year to get her moved, but we got her moved. And she lives in an environment where she can live and afford her payments. She has a payee that helps pay her bills. So now Lori is living better. She's happy, she's getting out, she's more active. Those are the kind of outcomes that you're looking for. They're not going to be the outcomes, by the way, that are on the scorecard I show you later, but they're the outcomes that we know make a difference. So the model elements for Tandem are that you do have to be 55 years and older. You have to be medically complex, and the insurance companies send us these referrals because they're looking at that 5% that are costing them the most money. Their social determinants are affecting their health outcomes. A holistic approach, that's part of our model element. When we started Tandem, we wanted to make sure that we looked at the whole person. And when I use the Betty Newman model, if you're a nurse in here, you know what that is. But that model of care really looks at every dimension of the person, the behavioral part, the development part, what happened to them in their life that makes them make the decisions they make today? Why do they behave the way they do? Who in their family, what catastrophic events have they suffered through? If we don't know all this about that person, we can't help them. We just can't help them. And I know that. I did home care for years, and you're in and out in 8 weeks. You can't make a difference in someone's life in 8 weeks. And so you have to get to the root of what these problems are. And that's what we do. We make sure that we understand every dimension of their life when we create that life plan. It's a comprehensive model of care, so there is an interdisciplinary team approach. So there's that word again. So who's on our team? The physician. But remember, we're not a PACE program. Our physicians are 700 of them that we're trying to connect with every day because we're using the primary care physicians in our plan. And it's 24/7 coverage. And so what that means is 24/7, 24 hours a day, 7 days a week, you're going to get the nurse that's on call that night of our program, but we also have our integrated care paramedics who are part of our program, huge part. So remember I said we had a fifth partner, which is the ambulance service. They do more than just respond in an urgent manner. They also do our after-hours dispatching, and they do our PERS falls devices. So if a person pushes their PERS I've fallen button, it rings to our dispatch. They know it's a Tandem participant, and they respond and triage differently. They do our telehealth flags. So if our participants are flagging, they make the calls. They're the first line on many things that we do every day. They're very visible in our program. So that 24/7 hour coverage includes an integrated care paramedic, a registered nurse, and our medical director. They're on call all the time that we can reach out to. We do work with the primary care physician during the day, but sometimes they're busy, and you know what that response can be. Send them to the ER. So we've had to do a lot of work to help them to trust us. Our whole program is built on trust. Trust with the participant, trust with their families, trust with the physician, and trust with the hospitals. And that big part of that is just being able to connect the dots. So the 24/7 coverage that I talk about is important for our model because we don't want them going back to the ED and we don't want them going in the hospital, which is one of our big measurements that we're measured against. And we do prevent a lot of those. The advanced care planning piece is another comprehensive part. It's a part of our model because without knowing what someone wants in the future, we can't really take good care of them. The last thing we want is for someone to die in the hospital on a ventilator when that was not their choice. So our social work team and our nursing team are trained to do advanced care planning, first and last steps, DNR, all of that. And we make sure we have a social work supervisor and operations that make sure that all those pieces are done on every participant that we have. Now, of course, there are those who say they don't want to talk about it, and we can't make them talk about it because we are very person-directed and person-centered in our model, so we do have to listen to what that person desires. We are very hospice and palliative care focused, and in that I mean we didn't start out that way. I'll be honest with you. We had a lot of things on our plate when we started, and we didn't realize, or we knew, but we didn't realize our staff weren't ready to have those discussions. They really struggled with having to have that difficult conversation. And what we kept telling them was that it's about the relationship. You have the relationship with them. Why can't you have that conversation? And so it took some time where they finally realized you can have it in a different way. It's really about what's best for them. It matters that you have it in writing and you get to choose what you want as, the solution when there's so many opportunities and so many options for care, right? So if we let them, sometimes we're going to be admitted to the hospital and we're going to have everything done. We're going to have every test done, and we can't control a lot of that. But what we want is the patient to be able to speak for themselves, our participants to be able to say what they want. That's the only way that we can really make a difference. Community and provider partnerships is key to Tandem. We don't recreate or reinvent any wheel. What we do is we partner with other health providers in our community. And that's important because we have to work with Medicaid waiver agents. We work with certified home health, and who's in charge and who's managing the case, and those are always the questions. And my navigators, the RNs and the social workers, know that their job is to connect the dots. Wherever that participant is, whoever's in their home, they need to know and they need to connect all the dots. And we're constantly engaging with the community regarding those supportive services. So who else can be on our team, including mental health services, which is a big gap, right, in any community. So who can we connect with to help be on part of our team to address all those needs? So sustainability and scalability, we are on a per member per month payment. Our first payer is paying us, the first payer we had, which is a Priority Health Advantage plan in Grand Rapids, was our very first. I have to say, really supported our program and has grown us to over 500 today. And we are in an at-risk contract right now with Blue Care Network, where we get part of our payment and part of it in a year, depending on our outcomes. It all depends on our management of our resources, and we know that. So there's limited resources in nursing, there's limited resources in social work, and we have to use them to the best of our ability and to increase their capacity but have it make sense. But we also use medical assistants, we use our integrated care paramedics, and we have a very robust volunteer system. We also need to scale beyond our current geography, and we're currently in 3 counties in West Michigan. And these are our quality measures that we're accountable for today. And as you read through this, just also know that one of the things Blue Care Network is asking us to do is to close their HEDIS measures and their diagnosis gaps. And while some of you may go, really, do we agree with some of those things? No, but you have to create value in order to get past that first step. And if we don't create the value with the physicians, we won't get anywhere. And we all know that's how they're incentivized. So we will figure out how to do it. So our future state is to enroll 2,000 plus. We want to expand our geographic reach, obviously seeking other funding sources that keep us sustainable. We have a lot of opportunities with the dual eligible project in the state of Michigan that we're really hoping to make a difference enough working with Blue Cross that we can get some notice there and hopefully do a pilot with them as well. I think the important thing to know is that everything Tandem does, obviously, we've changed our model probably 15 times since we started. We've had to look at what needs to happen, what didn't go well, what should we revise and change. But the main thing is we haven't changed our goals. The goal is still the same. We have to take care of these people. And the refreshing part is, look at all of us that are doing something about it today. The bigger question is, who's going to wrap all this up and put it into an understandable plan that we can really take out to the nation? Thank you.